Children in the United States experience violence in many forms. They are the victims of physical and sexual abuse within their families. They witness battering of and by their parents, and they may experience or witness violence in their schools and communities. Poor children are especially at risk for experiencing these forms of violence. The growing empirical evidence on child abuse reveals now um, alarming and very distinct patterns of familial relationships that will contribute greatly to this tragedy. Please take a moment and stop this presentation in order to review the learning objectives for this um, chapter. A dysfunctional family is one that cannot resolve the stresses and work through them in a positive and socially acceptable manner. And families often may face multiple pressures at the same time. This type of dynamic will create additional stress and adds to the risk of a dysfunctional coping mechanism. The atmosphere in a dysfunctional family creates additional stress for all family members, and because there is a lack of support within the dysfunctional family for those members, they will respond negatively to both real and maybe perceived issues. This family climate will set the stage for abused and other unhealthy coping behaviors. Today in the United States, any sort of mistreatment and abuse of children is regarded as unacceptable. We'll need to define now a few terms related to abuse of children. And we'll start by defining the term child maltreatment. This represents a broad term and is used to define all types of child abuse, including physical, sexual, emotional, and any other acts of negligence. Child maltreatment is usually committed by a person responsible for the care of the child. The term child abuse is used to describe acts of commission which may result in harm or a threat of harm to the child, while child neglect is used to describe acts of omission in which there is a failure to provide for the child's needs or to protect the child from harm. Each year, there is an increased number of child maltreatment cases that are brought to the attention of the authorities. There are estimates of the number of children treated in emergency department after an episode of abuse that may range between 700,000 and 1.25 million annually. However, most probably the actual number of abused children may be much more higher, and this is because many more cases may go undetected. Abusive parents can be found at all socioeconomic levels, but families with greater financial means may be able to evade detection way more easily. Low-income families show greater evidence of violence, neglected sexual abuse, according to some studies. And commonly, abusive parents have inadequate parenting skills. They have unrealistic expectation of the child. They may not respond appropriately to the child's behavior. State laws require healthcare personnel to report suspected child abuse, and this requirement overrides the concern for confidentiality. Laws have been enacted that protect the child who reports suspected child abuse from reprisal by a family caregiver, as example, by being sued by slander. I'm sorry. Even if it is found that the child's situation is not a result of the abuse, the nurse will still not be not going to be held responsible. If you do not report suspected child abuse, the penalty can be loss of your nursing license. On the other hand, the physical punishment that leaves marks, causes injury, or threatens the child's physical or emotional well-being is considered abusive. Physical abuse may occur when the family caregiver is unfamiliar with normal child behavior, and inexperienced caregivers may not know what normal behavior is for a child, and they may become frustrated easily when the child does not respond in the way that they will expect to. If inexperience is coupled with dysfunctional coping, the caregiver may physically abuse the child. When a child's physical injury requires medical attention, family caregivers may attribute the injury to some actions of the child that is not in keeping with the child's age or level of development. For example, a caregiver may attribute an injury to the child's playing in a competitive sport that the child is too young to play. The caregiver may also attribute the injury to an action of a sibling. When the child's symptoms do not match the injury the caregiver describes, be alert for possible abuse. Young and active children often have a number of bruises that may occur from their usual activities. However, most of those bruises will occur over bony areas such as knees or elbows, shins, and forehead. Bruises that occur in areas of soft tissue such as the buttocks, genitalia, thighs, back of the knees, upper back, nose, and eyes may be suspect. Burns are another common type of injury seen in the abused child. Although burns may be accidental in young children, certain types of burns are highly suspicious. Cigarette burns, for example, are common abused injury, and burns from immersion of a hand in a hot liquid, a hot register, is evidenced by a grit pattern or a steam iron or a curling iron, are other common abused injuries. Tell whether the following statement is true or false. Child abuse has come to mean any act of physical, emotional, or sexual abuse, including acts of negligence committed by a person responsible for the care of the child. The answer is false. The act of abuse must be intentional. Child abuse has come to mean any intentional act of physical, emotional, or sexual abuse, including acts of negligence committed by a person responsible for the care of the child. We'll discuss now the shaken baby syndrome. Shaken baby syndrome will occur when a small child is shaken by the arms or shoulders in a repetitive and violent manner. This shaking will cause a whiplash-type injury to the child's neck. In addition, the child may have edema to the brainstem, retinal and brain hemorrhages, loss of vision, cognitive impairment, or even death may occur following this aggression. Clinical manifestation of a shaken baby syndrome may include lethargy, irritability, poor feeding, vomiting, and seizures, but often the signs of this form of child abuse are not early observed and may be missed during physical examination. Internal symptoms are detected by use of computed tomography or MRI. Munchausen syndrome, and we will discuss here the Munchausen syndrome by proxy, is that situation when one person either um, fabricates or induces illness in another one in order to get attention. When a caregiver has this syndrome, he or she frequently brings the child to a healthcare facility and reports symptoms of illness when the child is actually well. The child, usually the mother, is most often the person that will present this syndrome. Often the mother may injure the child to get the attention of medical personnel. She may slowly poison the child with prescription drugs, alcohol, or other drugs, or she may suffocate the child to cause apnea. And many times, the symptoms such as seizures or abdominal pain are not easy to find on physical examination, especially when it's done after they happen. And it's hard to prove them when they are reported as history. The mother usually appears very attentive to the child and is often familiar with medical terminology. And this situation is frustrating for healthcare personnel, mainly because it is difficult to catch the suspect in the act of endangering the child. Close observation of the caregiver's interactions with the child is often necessary. For instance, if episodes of apnea occur only in the presence of the caregiver, be alert for the syndrome. The caregiver who suffers from this syndrome may receive psychiatric help. Injury from emotional abuse can be just as serious and lasting as that from physical abuse, but it is way much more difficult to identify. Several types of emotional abuse can occur, and they may include the following. The verbal abuse may be such as humiliation, a scapegoating behavior, unrealistic expectations with belittling, and sometimes erratic discipline. The emotional unavailability when the caregivers are self-absorbed or absorbed in their own problems. Insufficient or poor nurturing, or threatening to leave the child or otherwise end the relationship with the child. Role reversal, in which the child must take on the role of parenting the parent and is blamed for the parent's problems. Children may show evidence of emotional abuse by appearing worried or fearful, or having vague complaints of illness or complaining of nightmares. Family caregivers may display signs of inappropriate expectations of the child when in the healthcare facility by sometimes mocking or belittling the child for age-appropriate behavior. In young children, failure to thrive may be a sign of emotional abuse. In the older child, poor school performance and attendance, poor self-esteem, and poor peer relationship may be clues for emotional abuse. Child neglect. Child neglect is failure to provide adequate hygiene, healthcare, education, nutrition, love, nurturing, and supervision. All those elements being needed and essential for a proper growth and development. If a child is not given adequate care for a serious medical condition, the caregiver is considered neglectful. For example, if a child has a serious burn, even accidentally, and the caregiver is not taking the child for evaluation and treatment until several days later, this will be classified as negligence. Often, the child with failure to thrive as a result of being underfed, deprived of love, or consistently criticized can be classified also as neglected. However, be careful not to make an unsubstantiated accusation of neglect in some cases. The Federal Child Abuse Prevention and Treatment Act defines sexual abuse as, and I quote, the employment, use, persuasion, inducement, enticement, or coercion of any child to engage in or assist any other person to engage in any sexually explicit conduct or stimulation of such conduct for the purpose of producing a visual depiction of such conduct, or the rape, and in cases of caretaker or interfamilial relationships, statutory rape, molestation, prostitution, or other form of sexual exploitation of children or incest with children. End quoting. So sexual abuse of children has existed in all ages and culture, but it has seldom been admitted when perpetrated by parents or other relatives in the home. The abuser is most often a trusted male adult, and incest is common in sexual abuse cases. As with other types of child abuse, sexual abuse knows no socioeconomic, racial, religious, or ethnic boundaries. However, substance abuse, job loss, and poverty are contributing and risk factors. Like other forms of child abuse, sexual abuse is being recognized and reported more often. When a child is sexually assaulted by a stranger, the family caregivers usually become aware of the incident and promptly report it and take the child for a physical examination. However, in the case of the incest, the child rarely tells another person what is happening. The family member committing the act often intimidates the child with threats, appeals to the child's desire to be loved and to please, and convinces the child of the importance of keeping the act secret. The child may exhibit physical complaints such as various and awkward aches and pains, gastrointestinal upsets, changes in bowel and bladder habits. They may start to have what is called enuresis, nightmares, and acts of aggression or hostility. Some of those complaints or behaviors may be the presenting problem when a healthcare provider sees the child, regardless of the relationship of the perpetrator to the child. The outcome of the abuse is devastating. Sexual abuse by a person the child trusts seems to be the most damaging type. A 4-year-old boy is brought to the clinic with a vague history of stomach aches and vomiting. While in the clinic, the nurse overhears the mother telling the child that if he doesn't behave, she will just leave him in the clinic and not come back for him. The nurse knows that is what kind of abuse? A. Physical, B. Emotional, C. Neglect, or D. Verbal. The answer is B. Emotional. The emotional abuse includes insufficient or poor nurturing, or threatening to leave the child or otherwise end the relationship. Nursing diagnosis in this situation may include the following: anxiety, fear by child related to history of abuse and fear of abuse from others; impaired parenting related to situational stressors or poor coping skills; disabled family coping related to unrealistic expectations of the child by the family caregiver; ineffective coping by the non-abusive parent related to fear of violence from abusive partner or feelings of powerlessness. So whenever we are collecting data on a child who may have been abused or neglected, it's very important to observe and document thoroughly and completely. The child always needs a complete physical examination that will carefully describe and accurately document all bruises, blemishes, lacerations, areas of redness and irritation, marks of any kind on the child's body. Sometimes it may be necessary to request that photographs be taken. Perhaps the most difficult part may be to maintain a non-judgmental attitude throughout the interview and examination. So you will need to be calm and reassuring with the child and let the child lead the way when possible. Please observe the child for behavior that indicates anxiety or fear, such as withdrawal, ducking, or shying away from the nurse or the caregivers, and avoiding eye contact. One nurse should be assigned to care for the child so that the child can relate to one person consistently. Provide physical contact, such as hugging and rocking and caressing, only if the child accepts it. Identify nursing actions that seem to comfort the child and use them consistently. Use a calm, reassuring, and kind manner, and provide a safe atmosphere in which the child has an opportunity to express feelings and fears. Use play to help the child express some of these emotions, and be careful not to do anything that might alarm or upset the child. Psychological support is provided through social services or what is called an abuse team. Maltreatment often occurs when a family caregiver is unfamiliar with normal growth and development and the behaviors common to a particular stage of development. We need to help the caregiver develop realistic expectations of the child. To help accomplish this goal, when helping design a teaching plan, include the caregiver in the caring for the child. Discuss with the caregiver the child's expected responses and help him or her learn about normal development. And also, please praise the caregiver for displaying any type of positive behaviors. Point out specific behaviors of the child and explain them to the caregiver. Explore the reason for the caregiver's absence when he or she does not visit regularly. Also, you may need to discuss specific behaviors of the child that are upsetting to the caregiver and explain that these are common for the child's age. The family caregiver may be facing temporary or permanent placement of the child in another home. Help the caregiver and the child accept this change. Emotions that the caregiver has had for a long period cannot be easily eliminated, and the assistance of social services and the child life specialist can be beneficial in those situations. Act as a member of the team to aid in transition. The foster parents may need also support from the nursing staff to help ease the child's transition to the new home. Abused children must be followed up very carefully after discharge from the healthcare facility in order to ensure that their well-being is protected. What is one of the major goals for the abused child? And the options are A, subduing the abusive caregiver; B, removing the non-abusive caregiver from the family; C, relieving the child's anxiety and fear; or D, reporting the child's injury. Correct answer is C. One of the major goals for the abused child is relieving the child's anxiety and fear. Millions of children, unfortunately, are exposed to domestic violence each year. Domestic violence is a serious concern, and it's seen in families of all races, socioeconomic groups, and educational backgrounds. In cases of domestic violence, a person uses power and control over a power who is a partner or family member. Physical violence, threats, emotional abuse, harassment, and stalking are forms of violence often seen, and children who are exposed to or witness domestic violence are greatly impacted by it. The impact of domestic violence on the family is also great, and even if all family members are not victims of the violence, each family member will be affected in one way or the other. Children affected by domestic violence may show signs and symptoms that result from the violent situation, and those symptoms may be referred to as symptoms of post-traumatic stress disorder. They may include inability to sleep and bedwetting, temper tantrums, withdrawal, and feelings of guilt for not being able to protect the victim. The school-age child may have academic problems, frequent absences, behavior issues, or self-isolation. The older child will often use drugs or alcohol, get into legal trouble, many times by committing a crime against another person, or may attempt or even commit suicide. Children who witness domestic violence in their homes may become victims or perpetrators as they grow into adulthood. We'll address again the element of bullying. It's not the first time during this class that we look into this. Bullying is sometimes also called peer abuse, is a form of aggressive behavior that is deliberate and repeated, and is usually focused toward a person who is physically weaker, shy, or less able to defend him or herself from the abuser. The abuse can be physical and may include hitting or kicking or taking belongings. It can be verbal, by teasing, name calling, or insulting. Psychological, spreading rumors or exclusion, or even cyber, as text messaging and emails or in the social networking. Being the victim of a bully can have long-lasting psychological effects on the child, and the child who is being bullied may have injuries and bruises, but symptoms are often difficult to differentiate from other concerns. They may have physical signs. They may present with symptoms. They may complain of headaches or stomach aches, eating and sleeping issues, or some signs may be more subtle, such as anxiety or changes in moods, decreasing school performance, or avoidance of certain situations. The child may try to avoid doing certain things, such as taking the school bus or playing on the school playground, because they know that this is the place where the bullying is occurring. Parents, teachers, and nurses need to be observant for those behaviors and be a trusted resource for the child who is the victim of bullying. We'll address now the issue of parental substance abuse. And unfortunately, this problem has grown to alarming proportions since the early 1980s. More than 10% of children will come from a home affected by alcoholism of one or both parents. Alcoholism um, will take a terrible toll on the functioning of the entire family, and children of alcoholics have an increased risk on their own of becoming alcoholics. When other substances are included in the statistic, the number of affected homes will increase substantially. Adverse childhood experiences such as physical, emotional, or sexual abuse have a strong influence on alcohol and drug abuse as adults. Substance abuse is a family problem, and if one of the members of the family abuses alcohol and or drugs, every member of that family is affected. When a child is caught in the ups and downs of addiction, um, will have a parent that is not dependable and definitely will not going to be able to provide any stability for the child. The parent may waver between overindulgence when they are smothering the child with attention and leniency and gifts to just the opposite behavior of irritability and unreasonable accusations and threats and anger. All this unpredictable behavior has a severe negative impact on the relationship inside the family. Children of substance abusing parents often become loners and avoid relationships with others for fear that the substance abusing parent might do or say something that will embarrass them in front of their peers. Children will definitely react to parental substance addiction in a variety of ways. Children rarely will talk about the parent's problem even to the other parent. These children often experience guilt, anxiety, confusion, anger, depression, and they will have themselves addictive behaviors. An older child, often a girl, may take on the responsibility of running the household, taking care of the younger children, making meals, and performing the tasks that the parent normally should do and she should not. These children may become overachievers in school. but remain emotionally isolated from their peers and teachers. This child does not usually bring negative attention to the family, and substance abuse in the family is not often suspected based on the great behavior of this child. Another child in the family may try to deflect the embarrassment and anger of the other siblings by trying to make everyone feel good. As these children become adolescents and young adults, they may have problems such as their own substance abuse or eating disorders. The child in the family who acts out and engages in delinquent behavior is more likely to come to the attention of the social services and by doing that be identified as a child who needs